Well, good afternoon, and welcome to our press conference regarding the American Diabetes Association's Type 2 risk test and community education projects that they are presenting to us. Y bienvenidos a todos a esta conferencia de prueba para diabetes tipo 2 de la Asociación Americana Diabética. Thank you to the American Diabetes Association, to the Parkland Hospital District, and the Dallas County Health and Human Services Department for participating today in this conference. Gracias a la Asociación Americana Diabética, Parkland Hospital y el Departamento de Salud y Servicios del Condado de Dallas para su parte en esta conferencia. Diabetes is a debilitating disease, and type 2 is treatable with proper nutrition, exercise, and sleep. By paying attention to what we eat, exercising, and taking any medications as they are prescribed, we can manage diabetes and possibly avoid other health outcomes triggered by the disease. I was diagnosed about 15 years ago, and through diet and exercise, took no medication for about 2 years. The disease is still very controlled today, with my glucose numbers registering well within the normal range. But it takes attention every day to live a healthy lifestyle, to check for any signs of change in the body. I know personally the physical impacts of the disease, so I'm very committed to looking for ways to prevent it as well as treat it in our community. To help us, we need education about the risks and signs of diabetes. 2 parts of that community education include the Billboard campaign currently underway, as well as the online type 2 risk test, which is self-administered and takes less than 3 minutes. Preventing diabetes is the goal, but successful treatment is also available. Ultimately, this could save your life. La prueba disponible en línea de diabetes tipo 2 solo tomó 3 minutos y es disponible a todos. Diabetes es una enfermedad que se puede tratar con buena nutrición, ejercicio y durmiendo suficiente. Vamos a oír más de la prueba ahora. Let's hear from the other participants today, of the panelists today, about how this test can be useful for you. So please welcome Ted Gebhardt, who's the Executive Director with the American Diabetes Association of North Texas. Thank you very much.
Thank you, Commissioner Daniel. Really appreciate it. I'd like to start out by thanking Commissioner Daniel for providing the Commissioner's Court for this event, and to her staff for helping to get it organized. I would also like to thank Blue Cross and Blue Shield of Texas for being the corporate sponsor of the supporting initiative, and finally Clear Channel Outdoor for graciously providing the technical assistance in the Billboard space. We're also very excited about working with community partners like the Dallas County Health and Human Services Department and Parkland Health and Hospital System. This is a great team to spread the word on limiting your risk on preventing type 2 diabetes. The American Diabetes Association is in its 80th year as an organization dedicated to fighting diabetes. The association accomplishes this through 3 areas. The first is research. The association funds research across the country to manage, cure, and prevent diabetes. In fact, we have 5 projects currently being funded at UT Southwestern. The second area is education. The association provides a wealth of information to the public on how to manage and prevent diabetes, including areas of healthy eating, exercise, and medication. I encourage everyone to visit our website, www.diabetes.org, to find out more. The third area that the association is involved with, is our efforts include supporting government-funded advocacy, including government funding for diabetes research and programs, ensuring access to health, and our legal advocacy department actually helps individuals with diabetes who are experiencing discrimination at work, at school, and other areas of their lives. I'd like to end the association to talk about the association's mission, which is to prevent and cure diabetes and to improve the lives of all people affected by diabetes. But what I'd like to emphasize today is prevent. Nationally, 30 million people have diabetes, which is a staggering number. But even more critical is the 86 million people who are considered pre-diabetic. 90% of whom don't even know that. These are the people locally we are trying to help. The first step in prevention is to learn if you're at risk, which is what this campaign is about. Take 60 seconds to find out. Now I'd like to introduce Dr. Leslie Weisberg. Dr. Weisberg is the Executive Medical Director at Blue Cross and Blue Shield of Texas, working in Texas Managed Care and Texas Planned Performance, to say a few words on behalf of Blue Cross Blue Shield. Thank you.
Good afternoon. I'm glad to be here today on behalf of Blue Cross Blue Shield of Texas. This initiative has the potential to have a tremendous impact on the health of many people in the Dallas region. Early detection of prediabetes and diabetes is critical to preventing and impacting the disease. We are happy to partner with the American Diabetes Association, Dallas County District 1 Commissioner Dr. Teresa Daniels, as well as Clear Channel Outdoor, to encourage people with a high risk of diabetes, developing diabetes, to get tested. 2 years ago, Blue Cross Blue Shield of Texas launched a new $10 million initiative, community investment initiative, to help raise awareness around the prevention and early detection of chronic kidney disease, which can be associated with not only diabetes but hypertension. And this can directly impact the quality of life, productivity, and health of Texans. We made the strategic decision to focus our community investment resources on a long-term effort to impact chronic kidney disease because our claims data indicated that this chronic illness was not only driving up the cost of care, but again also profoundly affecting the life and quality of life of thousands of Texans. This initiative also aligns with one of the 5 pillars of our company-wide HCSC Affordability Cures initiative around healthy communities by identifying and supporting programs beyond traditional care settings to address and tackle determinants of health and to work to effect meaningful change not only for our members but for the community in general. Our goal is to partner with elected officials like Commissioner Daniels and organizations like the American Diabetes Association and companies like Clear Channel to impact change. Why is this important? Consider that an estimated 11% of Texans are diabetic, with more and more advancing to chronic complications such as chronic kidney disease at an alarming rate. The prevalence of diabetes has exploded to an epidemic level in the United States, with more than 29 million Americans living with the disease. Chronic kidney disease, primarily caused by hypertension and diabetes, has also soared and is increasing as well. Blue Cross Blue Shield claims data also showed 107% increase in diabetes with chronic conditions. If the trend continues by 2021, the prevalence of Blue Cross Blue Shield Texas members with diabetic complications will increase from 3% to 7%. Moreover, chronic kidney disease is the leading cause of end-stage renal disease. Texas has the 3rd largest number of individuals with chronic kidney disease in the United States and has the 2nd highest expenditure for this condition as well. 1 in 7 individuals living in South Texas are affected by this disease, and another 1 in 5 adults are at high risk for developing symptoms, according to the Texas Kidney Foundation. Blue Cross Blue Shield of Texas looks forward to its ongoing involvement with community initiatives like this one, the American Diabetes Association Risk Test Campaign, to improve the quality of life of Texans. Thank you. Now I'd like to introduce Dr. Philip Huang. Dr. Huang has been the director of the Dallas County Health and Human Services Department since February of 2019. Dr. Huang.
Thank you, Dr. Weisberg. As you've heard, diabetes really is a condition that has probably affected every single one of us in the room. We heard Commissioner Daniels' story. I know my own parents were affected by diabetes. And some of the local data for our own public health region, about 12% of adults in public health region 2-3 have been told by a health professional that they have diabetes. But then there are some subgroups that have even higher rates than that. About 16% of African Americans, 13% of Hispanics, And then in persons 65 and over, 28% have been told that they have diabetes. And you know, as you've also heard, pre-diabetes and knowing your risk factors, you can do something to prevent getting diabetes. Pre-diabetes is a condition, you know, where your blood sugars are higher than normal, but they're not high enough to diagnose as diabetes. And as you've heard, it's estimated about 1/3 of persons, adults, have pre-diabetes, but 90% of them don't know it. But you can prevent actually progressing them to full diabetes with doing things, weight loss, exercise, improving your nutrition. At the Department of Dallas Department of, what is it, DCH? Dallas County Health and Human Services. I'm still getting used to the Dallas, I'm sorry. Dallas County Health and Human Services Department, we do have a new program, Diabetes Prevention Program, which is part of the National Diabetes Prevention Program led by the CDC. It's an evidence-based program proven to prevent or delay development of type 2 diabetes. Year-long program is offered with a minimum of 22 sessions for participation. And the sessions are provided by certified lifestyle coaches that at the health department we now have those certified lifestyle coaches. The participants learn how to eat healthy, be active, reduce stress, and solve problems with an expected goal of about 5 to 7% weight loss. So we're very excited about this, Dallas County Health and Human Services Department. And our first class cohort is starting May 2nd of this year, so we hope you'll find out more about that. So next I'm pleased to introduce Dr. Luigi Meneghini, who's the Executive Director of Global Diabetes Program for Parkland Health and Hospital System.
Thank you, Dr. Huang. Thank you, Commissioner Daniel. This is something that's very important to Parkland and the Global Diabetes Program at Parkland. I'm here representing both today. It's incredibly important to address diabetes because it is a silent killer. And by silent killer, what we mean is that most patients that have diabetes, type 2 diabetes we're talking about, don't have many symptoms of the disease. And it is not uncommon in our Parkland emergency room or our Parkland hospital to have patients that get their new diagnosis of diabetes when they present with a foot infection that requires their foot to be amputated, when they present with vision loss because they have developed advanced retinopathy, when they present with kidney disease without knowing that they have had diabetes because they haven't been tested, because they haven't seen a physician, because diabetes hasn't given them symptoms until the complications. And the fact that so many people with diabetes, you heard a statistic, 25% of patients with diabetes don't know they have the disease and present with a complication, underscores the importance of this type of campaign. And even more importantly, identifying pre-diabetes gives us an opportunity of actually identifying individuals who have the chance to prevent or delay progression from pre-diabetes to diabetes, to type 2 diabetes. And that prevention means that these are individuals that have a lower risk, or will have a lower lifetime risk of developing eye damage, kidney damage, nerve damage because of hyperglycemia, or suffering the consequences of these. At Parkland and with the Global Diabetes Program, we have worked closely actually with the American Diabetes Association. We have a program called Diabetes Inside that funded a couple of our quality improvement initiatives. And one of the initiatives is currently wrapping up. And it was an initiative to identify individuals with prediabetes within our health system. We looked retrospectively at health records. We have embedded a risk engine into the electronic medical record. And we now have a prediabetes registry with over 16,000 individuals that are part of this registry. And our next step is, importantly, to partner with community resources, to connect these patients with lifestyle intervention, with dietary intervention, both internally within Parkland, but also externally with the community partners and resources, because without them, I don't think that we could function. So this is, I think, the reason why campaigns such as this are so extremely important, why I'm so honored to be here, and I want to thank you all for listening. Now it's my pleasure to introduce Teresa Moore from Clear Channel Outdoor to wrap up.
Thank you very much for having me here. Clear Channel Outdoor is donating about 25 billboards across the state of Texas for this initiative, 10 here in Dallas and Fort Worth Market, and we hope to reach about 90% of the population here in this market with your powerful message. And the value of our donation is upwards of $30,000 across the state. $75,000 across the state, $30,000 here in Dallas-Fort Worth. So we're glad to be able to offer you that service and hope that it makes an impact in our community. Thank you.
Just wanted to say thank you very much for coming out this afternoon and having enough interest in a topic that impacts all of us. That is an important topic for health status in our communities. Diabetes, early detection, and preventive steps are what you've been hearing about here. And community education is a huge piece of that. So the research that Blue Cross Blue Shield has been doing is vital. And then the bringing together of community partners such as Clear Channel Outdoors to help spread that word is so appreciated. It's the partnerships that we find between Parkland Hospital, Health and Human Services of Dallas County, coming together to see what are better ways to positively impact the residents of Dallas County and further. So, Teresa Daniel, Dallas County Commissioner, saying thank you, thank you, thank you.